I was born in Lebanon. My parents are both Muslims, and I was born at a time where Lebanon was in a big mess. It was a big civil war going on. Both my parents and myself, we did everything that we could to get out. The whole concept that everyone is created equal, the concept that you take an oath to defend a constitution, the freedom that comes with it. You would appreciate all of this stuff only when you don't have it. And it just happened that at the end of my second year, an Army recruiter was in the hallway, and I had a conversation with him, and he's like, I can fly you all the way to Fort Bragg and you can meet with an internal medicine consultant, because I was doing internal medicine residency at the time. Finished up residency, I came on active duty, did my officer basic, and the news came like, hey, you're going to Hawaii. I'm like, whew, okay, I'll go to Hawaii. I talked to a few people about my intentions to actually go back and do more training and become a cardiologist, and they're like, we have training here in the Army, and the biggest fellowships in the system are active duty in the Army. Did my fellowship and accrued an obligation from it, and I've been on active duty since, and I wouldn't trade it for the world. I created the Preventive Cardiology Clinic, and eventually it won a couple of awards. One of them was a Military Health System Award just for prevention of cardiac disease. I'm also the Director of Advanced Cardiac Imaging, and we have one of the top imagers and imaging equipments in the nation. So this is one of the machines that we use for cardiac CT, and as I mentioned earlier, it's our workhorse. We do a lot of cardiac CTs because it will give us a lot of information to rule out cardiac disease, chest disease, and a lot of our soldiers who have chest pain. During the era of Saddam and during the war that followed, a lot of the senior physicians in Iraq left. Either left or died during the Saddam era. So most of the physicians, they were being trained by junior physicians with not a lot of expertise. So over-the-shoulder program was a program created to improve that, to provide these young physicians with resources, with internet access, with websites that would lead them to the most up-to-date evidence-based medicine, and at the same time give them hands-on exposure to acute trauma care. You're there for everyone that needs you, and it's a feeling that no other mission on the civilian side can replace.